CNA Study Guide PDF. Welcome to the quiz. Question 1. You are participating in a quality improvement initiative focused on fall prevention in your facility. Part of the initiative includes modifying patient environments to reduce fall risk. You understand that the patient environment significantly affects fall risk. Based on proper environmental modifications for fall prevention, how should a patient's environment be modified to prevent falls? Option A. Scatter furniture throughout the room to provide walking pathways through the space. Option B. Ensure adequate lighting, keep walkways clear and free from clutter, provide grab bars in bathrooms and near beds, and remove tripping hazards. Option C. Keep the environment cold to help keep patients alert and awake. Option D. Remove all furniture from the patient's room to prevent any obstacles. The answer is B. Fall prevention includes good lighting, clear pathways, grab bars, and removal of tripping hazards. Option B is correct. Option A increases fall risk. Option C. Temperature does not prevent falls. Option D. Removing all furniture is impractical and unsafe. Question 2. You are assisting Mrs. Dorothy Williams, an 80-year-old female patient, with hygiene care. During the process of helping her wash and change her gown, you accidentally expose her breasts momentarily while changing her gown. She appears embarrassed and uncomfortable about the exposure. You recognize this is a sensitive situation. Based on appropriate response to accidental exposure of patient private areas, what should you do? Option A. Ignore the exposure and quickly move on without acknowledging what happened. Option B. Explain what happened and protect her privacy immediately by covering her and apologize for the inadvertent exposure. Option C. Tell other staff members about the exposure and laugh about the incident. Option D. Make a joke about the exposure to try to lighten the mood and make the patient less embarrassed. The answer is B. If you accidentally expose a patient, apologize, cover them, and maintain dignity. Option B is correct. Option A dismisses the patient's feelings. Options C and D are unprofessional and disrespectful. Question 3. You are assisting Mrs. Patricia Clark, a 72-year-old female patient who has osteoarthritis affecting multiple joints, including her knees, hips, and hands. She experiences pain and stiffness with movement, and she has limited range of motion. She is asking for your assistance with positioning and gentle movement. Based on appropriate care for patients with arthritis, which approach is most appropriate? Option A. Avoid moving the affected joints at all to prevent pain. Option B. Encourage gentle movement and assist with positioning for comfort. Provide support to affected joints, and perform gentle range of motion exercises to maintain mobility. Option C. Force the affected joints through a full range of motion daily regardless of pain. Option D. Keep the patient immobilized completely to prevent any discomfort. The answer is B. Arthritis care involves gentle movement, positioning, and ROM within pain limits to maintain function. Option B is correct. Option A leads to stiffness. Option C can cause injury. Option D is counterproductive. Question 4. You are working on your unit when you provide care to Mr. Anthony Carter, a 68-year-old male patient. During care, the patient becomes increasingly angry with you, raises his voice, uses harsh language, and appears hostile. You feel uncomfortable and defensive about his treatment of you. Based on appropriate response to verbal abuse from a patient, how should you respond? Option A. Become defensive and argue back with the patient to defend your actions. Option B. Match the patient's tone and verbal aggression to show him you are not going to tolerate his behavior. Option C. Remain professional, stay calm, set clear boundaries about acceptable behavior, and report the incident to the nurse. Option D. Refuse to care for the patient for the remainder of your shift. The answer is C. When a patient is verbally abusive, remain calm, set boundaries, and report the incident. Option C is correct. Options A and B escalate the situation. Option D may be necessary if safety is compromised, but reporting is still required. Question 5. You are documenting care provided to a patient in the medical record. The documentation requires recording information about the patient's bowel movements. You understand the importance of thorough documentation of elimination. Based on documentation standards for bowel movements, what should you document regarding a patient's bowel movement? Option A. Nothing should be documented unless the bowel movement appears abnormal. Option B. Document the frequency of bowel movements, the consistency and color of stool, and any difficulties such as straining or incontinence. Option C. Only document bowel movements if the patient specifically asks you to record them. Option D. Document the exact time to the minute without any other details. The answer is B. Bowel movement documentation includes frequency, consistency, color, and any issues. Option B is correct. Options A, C, and D are incomplete. Question 6. You're assisting Mrs. Helen Thompson, a 70-year-old female patient who had total hip replacement surgery 4 days ago. You are learning about positioning restrictions for hip replacement patients. The surgical team has emphasized that certain positions could compromise the surgical repair and should be avoided. Based on proper positioning after hip replacement surgery, which position should be avoided for a patient who has had hip replacement surgery? Option A, supine position, lying on back, should be avoided. Option B, side lying on the unoperated side should be avoided. Option C, hip flexion beyond 90 degrees on the affected hip should be avoided to prevent dislocation. Option D, semi-Fowler's position should be avoided. The answer is C. After hip replacement, avoid hip flexion greater than 90 degrees, adduction, and internal rotation to prevent dislocation. Option C is correct. Supine, side lying on an operated side, and semi-Fowlers are typically allowed. Great job! Don't forget to subscribe. Bye!